I'm good. Okay, so everything looks very stable. So we still don't need to do treatment for you. The bone marrow biopsy, how it showed the smoldering myeloma.
Okay.
So we're just watching that every 3 months is still the same plan.
Okay.
I didn't see much changed in your lab, which is good. You know,
Okay.
things won't ever like go down completely. We just watch it to make sure things don't get worse.
Okay.
Okay.
That's good.
So just to explain things further, with the abnormal protein, things we look at is making sure your red blood cells don't drop. So 11.3 is very stable. You're just kind of right on the line. 11.5 and above is normal. So we make sure this doesn't drop, which is probably a little low from the kidney function.
Okay.
Okay, so that hasn't really changed. And then your kidney function still isn't the greatest. It looks slightly better, about the same it was last time.
What does it say? I can't read it.
The creatinine's at 2.3, and then your GFR is at 22. Have you seen the kidney doctor lately?
Yeah.
What did they say?
It was a 28 when I seen her.
Okay.
Because I just did blood work a couple weeks ago
Okay.
for her. So
And
it went to
everything,
28.
they're just watching.
She put me
and
back on high blood pressure medicine. It's not
Okay.
the last time I seen you.
Yes.
She took, we
It
went
was
off
too
of it.
low, and
Yeah. So she tried to put me on something, started with an M, like a microcrate or something. But
Okay.
when you look it up, it's like for someone who had a kidney transplant.
Okay.
And my insurance wouldn't cover it because it was a specialty drug.
Uh-huh.
So now she just recently put me back on high blood pressure medicine.
Okay.
2 weeks ago, 3 weeks ago.
Okay. Okay. And yeah, so as long as you're still following with your kidney doctor, nothing's really changed on our end. Now the IMSPEC, this is the abnormal protein. So if it becomes in higher amounts, that's when we start talking about needing treatment, or if we see other
Okay.
changes. In your case, it's very stable. It's actually lower.
Oh.
Last time you were at 0.5, you're at 0.15 this time, which is very good. It will bounce around kind of up and down. That's
Okay.
normal. What we just don't want to see is it going up. Like say next time it goes up and then goes up and up and up. Like you have to kind of trend it for a while. But
Okay.
so this is a good sign. Everything's very stable. So of course they see the protein there. And then this is part of the free light chains, which is part of the abnormal protein. And this is basically unchanged. So that didn't go up any higher. And all your immunoglobulin levels are perfect, so that's good. And this is also just a marker with the myeloma. So everything on our end is very stable. So our plan would just be every 3
3
months.
months do blood work.
Yeah.
Okay.
If something ever changes, gets worse, then we start monitoring like every month, but 3 months is just fine.
Okay.
Yeah. And then, so there's a copy for you. And then you did the PET scan. And so what it showed is, you know, what we're looking for is any bone lesions. Because when you have this abnormal protein in the bone marrow, it starts spreading and then it can put little lesions on the bone when it crowds out your healthy tissue. Not seeing any bone lesions, so that's good. I probably repeat this in like 6 months to a year. It just says in your neck, this is just kind of an incidental finding. The left side of your neck, you have maybe just like a little lymph node. Is there any? I'm gonna feel here and see if you. No, it's not even enlarged by size. It's only a centimeter, which is kind of a normal size lymph node. But you don't ever have anything that like swells up and down on this side.
Okay. So what could that cause?
So it's probably just nothing. Like it's probably just the radiologist
I was trying to read it myself and looking up words.
Yeah.
And looked up like some things. Said it could be some weird name. And it said something about lungs.
Let's see. So going back to this lymph node, it looks like it could just be, you know, physiologic, which means that's kind of just your normal versus inflammatory. So there isn't really anything, unless you're having any issues with your neck.
No.
Then you would see it ear, nose, and throat. But
Okay.
I'd probably just repeat this in like 6 months just to make sure everything looks okay or nothing's getting bigger. So that's one thing they showed. And then the other thing was, well, they say your spleen's fine, which is good. In your right throughout your lower leg. Do you have leg issues on the right side?
I've had varicose vein surgery twice.
Okay, so that's what they're saying. They're seeing in throughout the lower leg, it looks exactly, I guess you've had a CT scan and they said it corresponds with the CT. So it doesn't sound like it's anything.
I've had
new
surgery,
concerning.
because when I was younger, I had my heel caught in the chain of a bike
Oh
when
my
I was like
goodness.
5 years old. Ever since then, I have like varicose veins in this leg.
Yeah. Oh.
Yeah, I had surgery twice already on it.
Jeez. Okay. Well, that just sounds like, so when they say physiologic, that's basically like normal.
So I don't have to worry about like when it says something about
So mild cardiac.
cardio.
It just means your heart is a little bit enlarged. So with the kidney function, all that, you
Okay.
just have to be very careful.
Okay. And then another thing I have it written in my thing that's in there. It said something like this in there.
Okay, let's see.
Like in the, said could be, I read it in there. It says could be, let me see. Let me see if I have a copy of it on my phone. I know I read it.
I wonder if it was on the CT scan. I don't know, wait a minute, I don't see that. It says, no abnormal uptake in the chest. Head and neck.
Let me see where I seen that.
Oh, it says, patchy right basilar opacity, not FDG avid, likely basilar atelectasis.
Yeah.
So do you smoke or ever were a smoker?
No.
Any like history of asthma, COPD, lung
Nope.
issues? So it can be, if you're just not taking deep enough breath, it can
Okay,
be
so it's
that. So
nothing-
it's nothing major.
I'm looking it up and like a long.
No,
so
no,
I'm
no,
like,
no,
oh,
no.
yeah.
It's
Okay.
so like those tiny little air sacs collapse. Sometimes it can be seen in like COPD or people with lung
Oh.
issues or people who are smokers or asthma. But if you're not having like cough, shortness of breath,
No.
nothing, then it's probably just like due to like, I would say just make sure you're exercising, taking deep breaths. That's kind of the big thing. Like
Oh, okay. So
lung
nothing to worry about.
capacity. Yeah,
I was
nothing
trying
to
to
worry
read
about.
on myself, trying to
Yeah.
like looking up everything and.
No, unless, or, if you ever had cough, fever, get into your primary care,
Yeah.
because that could be signs like, or after, like if you've had COVID or pneumonia, something like that.
Oh,
So
okay.
if you're not having any issues with your lungs, then nothing to do about it. But it's something to be aware of. So if you start getting like cough,
Okay.
shortness of breath, fevers, anything weird, go to urgent care.
And I
or
did see
primary.
it showed I had my gallbladder out.
Yes, yeah. Yeah.
I read that. I had to look up that word.
Yeah.
What it meant.
So we may just repeat in like, I would say, even a year. It would be fine.
Okay.
Okay? All right. Well, we'll just see you again in 3 months and keep an eye on it. I mean,
Okay.
nothing really new has changed or popped up, and that's all we're doing is just making sure you don't need treatment yet.
Okay.
And
And
it's
the
hard
PET
to
scan
say
is
when.
good.
Yes, PET scan's good. So,
Alright.
it really, unless something changes in the PET scan, we usually do them every 1 to 2 years, and then we do the labs every 3 months.
Okay.
Because we don't know when or if you will need treatment. It could be next time I see you. It could be 2 years from now. It could be 10 years. You just never know. So
Okay.
that's why, even though we don't have much new to talk about, that's kind of
We
what
still
we
gotta
want.
keep watching it.
Yes, to
Okay.
just every 3 months keep an eye. If we get to a point where we don't see a big change, sometimes we can even go like 6 months. But for a while, I want to, since this is all new, we want to keep a close eye.
Okay.
Okay.
All right.
All right.
Thank you.
Well, yeah.
Nice seeing you
Yeah,
again.
good to see you. I'll see you in a few months unless
Okay.
you need anything before then.
All right. Thank you.
Soon. Yeah. So you can just make that next appointment out.